Hello, and welcome to Psychosocial Interventions for ADHD in Adults, a guide for primary care providers. My name is Dr. Russell Ramsey from the University of Pennsylvania. Regarding any financial conflict, I have no financial conflict that will influence this presentation. The objectives for this session: after completing this module, participants will be able to identify psychosocial treatments for adults diagnosed with ADHD and also make appropriate referral suggestions for patients with ADHD, adult patients with ADHD, based on their presenting complaints, the problems that they're facing. Very often, providers are asked questions by their patients. The medications are helping me, but I'm still having problems. What else can I do? Or also, I've tried medications. Is there something else that can be helpful? The purpose of today's session is to talk about the various options that you have for your patients and how to guide them to getting the help that can be most helpful for them. But first off, what are psychosocial interventions for adult ADHD? Psychosocial interventions are non-medication interventions that are designed less so to target the symptoms of ADHD, but more so to get to the daily life impairments and struggles that patients often have. What are some of these interventions that we'll be covering today? First, psychoeducation, helping patients understand adult ADHD and how it affects their life. Cognitive behavioral therapy, also educational accommodations for students or other graduate students or professional students. Workplace is another important area, so we'll be discussing employment accommodations. There are also many treatment options for relationship difficulties and also financial management for money management difficulties that patients may report. When are these treatments appropriate for adult ADHD patients? When they're experiencing ongoing coping difficulties despite an otherwise effective medication regimen. Also, many patients may have a medical profile that obviates the use of medications, for example, if there's some cardiac risk factors. And finally, some patients may simply choose not to pursue medication management and they're looking for other options. How can psychosocial treatments help patients with ADHD? First, residual symptoms even despite effective medication management. Again, educational difficulties, workplace difficulties, relationship problems, difficulties handling money. Many patients will have coexisting psychiatric diagnoses, mild mood, anxiety, or substance use problems. In fact, simply any major impairment in an adult role that is not being adequately treated by medications would be appropriate to make a suggestion for an additional psychosocial treatment. Regardless of the psychosocial treatment, the first thing to encourage patients to do is get educated about adult ADHD. You or another provider can teach the patient and the family about ADHD, provide an overview of what ADHD is, what the symptoms are, how it's diagnosed. In fact, many of the screening scales and the information in your toolkit will be very helpful to inform you so that you can inform your patients, but the providers of psychosocial treatments will also be able to do so. You can also overview the various treatment options that we will overview today. And finally, hopefully the psychoeducation instills hope or optimism that there's something else that can be done in addition to medications. One of the best researched psychosocial treatments for ADHD is cognitive behavioral therapy. What is cognitive behavioral therapy? In general, it's a model of psychotherapy that really emphasizes the interplay of thinking patterns, behavioral patterns, and how they can affect emotions. There's strong empirical support for CBT as a psychosocial treatment for depression and anxiety, and more recently, there's been studies on CBT as a psychosocial treatment for adults with ADHD. It's been modified from its traditional form to address some of the specific problems focused or experienced by adults with ADHD, such as organization and planning, time management, procrastination. A benefit of CBT, it can be delivered individually or in group format. And the nice thing about CBT is it targets the real-life impairments experienced by adults with ADHD. It helps deal with the problems that they're coming in describing to you. In particular, CBT helps instill and maintain effective coping strategies, thereby improving overall well-being. Even though negative thoughts don't have anything to do with the onset of ADHD, These thought patterns can develop from a lifetime of living with the frustrations associated with ADHD and can lead to excessive pessimism and giving up on using coping strategies that might otherwise be helpful. It's also nice because of its evidence base with the treatment of depression and anxiety. It can be helpful to deal with the coexisting problems that many adults will have. It has strong evidence support. A number of published studies have yielded positive results, including several randomized control design studies. But a common question patients might have, how is cognitive behavioral therapy going to help me? I know what I need to do and I just can't do it. The patients can be reminded that CBT, it's not just telling you to do the same thing over and over again. Working with a skilled therapist, you can figure out why you're still having difficulty implementing these coping skills. Again, psychoeducation about adult ADHD and developing a personalized understanding of how it can affect day-to-day life. Some students who have ADHD may not require cognitive behavioral therapy, though it has been found to be helpful with young adults with ADHD. College students with ADHD most likely are going to have educational impairments. They're going to have difficulties in the college or graduate school setting or any other adult continuing education setting. One intervention that can be very helpful is academic accommodations. These are adjustments to the typical learning, classroom, or test-taking environment to help accommodate for the symptoms of ADHD. To get formal academic accommodations, there are specific requirements that must be fulfilled, and it's important to inform your patients of what these are. First, there needs to be a comprehensive psychoeducational evaluation performed by a qualified professional using the standard diagnostic procedures for ADHD as outlined in your toolkit, and there's a number of other tests to help identify any specific learning impairments associated with ADHD. In terms of recommending specific academic accommodations, those accommodations have to be tied with the results of this evaluation. So it's more than just getting a doctor's note that somebody has ADHD. A diagnosis of ADHD alone is not sufficient. But once that's established that there is ADHD and there are specific learning impairments, there are many accommodations that can be very helpful for students. The most common is extended time in which to finish in-class examinations. They can also be taken in a distraction-reduced environment. Students with ADHD might be granted access to lecture materials before the class in order to prepare earlier, and there are various technologies, assistive technologies, that can be helpful in the learning and studying process. In addition to these in-class and academic accommodations, academic coaching or specialized learning support is emerging as a potentially very helpful psychosocial treatment for college students with ADHD. Learning support services help ADHD students develop and implement effective learning strategies, knowing how to organize a paper, knowing how to break down assigned reading. They can also benefit from focus on organizational and time management strategies outside of academics that can affect academics, such as setting up a daily planner, organizing the study and recreational schedule for the week, and various other difficulties commonly associated with ADHD, including making adequate use of assistive technologies. Academic coaching also has promising preliminary research supporting its use. The common features of the program studied so far are accurate identification of ADHD and coping skill deficits, specialized support that targets learning strategies in the classroom, test-taking strategies, and also the consistent use of these coping skills. In fact, the most consistent finding is that independent use of coping skills and a positive alliance with the coach predict the positive outcomes in academic coaching. But regarding the academic accommodations, a common question you might field: should I or should my child disclose his or her diagnosis to the school? It's an individualized decision, but in weighing the pros and cons of do I disclose my diagnosis of ADHD and seek these services, or keep it to myself and try it on my own, because difficulties can arise so quickly in the course of a semester. This is a case where having the psychoeducational assessment done, getting all the paperwork submitted and filed, the student is not obligated then to use the accommodations, but can have access to them if needed. It can save the student from finding him or herself struggling in the middle of the semester and then rushing around trying to get an evaluation. So the pros of disclosing, at least to the Office of Student Disabilities, seem to outweigh the cons. Workplace. After completing school, many adults with ADHD may figure that many of their struggles will be relieved by getting into a consistent work environment. However, research has shown that adults with ADHD continue to have significant coping difficulties in the workplace. It really affects virtually all areas of life. Now, workers who are otherwise qualified for their job may qualify for similar accommodations as students. However, it can be a little more difficult to disclose to the workplace, and people struggle with whether or not to disclose, so people might hold off on seeking formal accommodations. However, there are many informal accommodations or coping strategies that workers can implement to improve their work productivity. Very often patients will ask, what else can I do? Well, that's where psychosocial treatments such as ADHD coaching, in addition to implementing coping skills on one's own, having access to a coach who, similar to an athletic coach, provides reminders, works with the adult with ADHD to set up a work plan at work, has been found to be very helpful. There's only been one outcome study of ADHD coaching for adults that yielded positive results, but anecdotally, it's a growing field and many people would describe it as being helpful in terms of implementing and, most importantly, following through on the use of coping strategies. Specific employment accommodations that can be helpful for workers with ADHD, whether instituted formally or informally, making good use of assistive technology like computer software, voice-activated software if somebody has difficulty typing or writing, making use of a dictation service if possible at work. Trying to schedule more frequent meetings with a boss or supervisor in order to break down and track progress on large tasks is something that will demonstrate responsibility to an employer and also can be helpful for the adult with ADHD who's looking to cope better at work. A similar question workers with ADHD might have to students with ADHD is, should I tell my employer that I have ADHD? Here's where weighing the pros and cons is a little trickier. In order to seek formal accommodations, one should disclose the ADHD diagnosis and impairments as soon as possible. However, in weighing the pros and cons, many employees will say, if I'm interviewing for the job, this may influence the decision of whether or not to hire me. So very often people will hold off on disclosing that early. In terms of what about after I'm hired and I've been there for a while and I'm struggling? Again, it's a very individualized decision, and even in anecdotal reports from experts, there's been no consensus on making a recommendation, yes, you should or no, you shouldn't. It's very individualized, but generally the informal accommodations can often be negotiated without disclosing the ADHD diagnosis, and in some rare cases, some psychosocial clinicians have found that when there is a supportive workplace, there can be a disclosure of the diagnosis, and in some rare cases, supervisors will actually consult with clinicians, but it's an individualized decision to be made carefully. In cases of extreme work coping difficulties for adults with ADHD, vocational rehabilitation services or vocational counseling services can be helpful for people who have difficulty finding and keeping employment. And in some cases, vocational rehabilitation counselors will have ongoing communication with employers, helping to engage in group problem solving regarding any difficulties that may emerge. Similar to academic difficulties, workplace difficulties, ADHD also touches on relationships. And when we think about relationships, it cuts a wide line through life. It can affect marriages or committed relationships, parenting relationship with one's children, co-workers, and just general friendships in one's life. There's been no outcome studies of relationship treatments for adults with ADHD. However, it makes sense that it would be helpful to find a relationship counselor who's experienced with ADHD. That way they can factor in the symptoms of ADHD in understanding the dynamics of your relationship difficulties. Regardless of the lack of strong evidence, there is some clinical consensus about what are some of the components of a good relationship treatment. First, as is replicated in your toolkit, the accurate diagnosis and treatment for adult ADHD is essential. The adult with ADHD in a relationship may have to pursue individual treatment on the side in addition to the relationship treatment. Within the relationship, communication skills training, looking to enhance positive communication and reduce destructive communication. Collaborative problem-solving skills, being able to identify and work through problems, in addition to scheduling various relationship-enhancing activities to foster the positive feelings in the relationship, be it a romantic relationship or a parenting relationship. Another area of difficulty for adults with ADHD that is getting more and more attention is struggles with financial management, managing money. In fact, regardless of ADHD, money difficulties are a prime source of relationship difficulties. So in terms of some coping suggestions for individuals with ADHD struggling with money, in addition to seeking specialized help, looking to outsource financial matters, setting up electronic payment plans for finances to pay bills on time, to make automatic deposits into a retirement or savings plan to avoid difficulties with impulsively spending money, and also using software to track income and also spending habits to get raw data to counteract impulsivity. Other coping skills for financial behaviors, drawing on some of the other psychosocial interventions, cognitive behavioral therapy, looking at thoughts about spending, beliefs, and feelings about money can be helpful, in addition to reinforcing various coping strategies, such as instituting delays or having a rule that somebody consults with a trusted significant other before making a major purchase. In some cases, patients may come to you with significant difficulties or come back to you after trying some treatments saying, these have been helpful, but myself or a loved one continues to struggle with significant impairments. In cases of significant emotional problems in addition to ADHD, such as anxiety, severe depression, anger management problems, seeking other psychotherapy, including cognitive behavioral therapy, targeting these difficulties specifically in addition to ADHD would be indicated. In some cases, one's ADHD symptoms are so severe, there are severe impulsivity, self-control difficulties, that there may need to be some more intensive executive control rehabilitation services, in addition to revisiting a pharmacotherapy regimen and also the general treatment plan, in addition to consulting with the family as a whole, doing some group problem solving. So, in summary, there are many very effective psychosocial treatment options out there. They can be a very useful adjunct to medications, and in some rare cases in which medications are not being used, they can be helpful treatment approaches that can make a positive impact in a variety of life roles and life settings. Cognitive behavioral therapy in particular and academic coaching have strong research support. There are a wide range of mental health professionals, psychologists, ADHD coaches, learning support specialists at post-secondary institutions, family and couples therapists, in addition to vocational rehabilitation counselors who can be helpful. The important takeaway from this session is that there are many helpful treatment options. You can provide more specific information about the menu of options drawing on this session, your toolkit, and also in listening to your patients and the problems that they're describing. You can also provide more personalized referrals for specific treatment approaches based on the specific difficulties described by your patients. Thank you very much for your time.